Ecuador, a lively, warm, welcoming country, a land of stunning scenery and a beautiful people. But a country marred by desperate poverty. There is no room left in the big cities. Squatter villages spring up around places like Quito and Guayaquil. Squalid shacks, some with no electricity or running water. It is here that Por Cristo has chosen to take a stand. Social worker Laura Villafuerte goes door to door, imploring people to make good use of Por Cristo's clinic, like this young woman, who is failing, though no one knows why. Within minutes, an appointment has been made at the clinic for the next day. At Por Cristo's Nutrition and Health Center, Vilma Campoverde is teaching these new mothers about the importance of good nutrition. In 1996, Por Cristo built this center so that children wouldn't suffer or even die from malnutrition, here in one of the poorest neighborhoods of Guayaquil.
¿Cuántos años tiene el papá?
Now, every little patient is weighed and measured. The results are tracked over time, and the results are remarkable.
We began with nearly a third of all children here malnourished. Now it's 7%. So even though malnutrition still persists, the situation's greatly improved.
The clinic has since expanded services to include prenatal care, respiratory therapy, even a dental practice. It now employs 16 Ecuadorian staff, including Dr. Juan Rodriguez.
I'm here because it's very special, and I know the work I do for these people is meaningful and much needed.
The hope that Por Cristo has brought is changing the face of the neighborhood, says Joseph Reardon, executive director.
We're able to really mark progress over time, and I can tell you there's been enormous progress made. It literally started from absolutely nothing. It's hard to visualize that when you're here now. There was no light, there were no paved roads, no running water. There was literally nothing here.
Por Cristo was founded in 1979 in response to a challenge by Pope John Paul II to share our abundance with developing countries where the magnitude of need is overwhelming. Por Cristo, a non-profit arm of Steward Healthcare, is meeting that challenge.
We see children in Ecuador who, if they were born in the United States, could have medical care that would save their life when they would grow to an old age. But because they're born in Ecuador, their lives will be completely different.
Dr. Thomas Haugen leads Por Cristo's pediatric cardiology team that regularly visits Ecuador, treating patients and offering training to the Ecuadorian staff. Not all the problems are life-threatening, but all of the solutions are life-enhancing. Dentist Dr. Dick Armijos from the Por Cristo Clinic regularly visits 7 local schools, providing dental hygiene lessons and fluoride treatments to over 2,000 school children, like those here at St. Rose of Lima School. St. Rose's pastor, Father Jose Manuel Delgado, is grateful for the help of Por Cristo, and he has the highest hopes for the children in his care.
What I hope for them is that they can learn what they need in life in order to be good people, what they need to learn in order to be able to have a nice job and have a different kind of life, but especially to be good people.
Ecuador is all about families. Children here are treasured, but young girls often have little time to be children. This 14-year-old is already pregnant. Por Cristo will help make sure she has a healthy pregnancy, but Dr. Rita Rojas worries the girl is almost certainly destined for a life of poverty. Does it make you sad when you see a young girl, 14 years old, already having a baby?
Yes, because this girl has a bleak future. She has little possibility of getting an education. And there's a good chance her baby will have respiratory or digestive problems. Imagine a child taking care of a child.
Dr. Rojas and her colleagues at the clinic have developed their own antidote to teen pregnancy. a self-esteem curriculum for young girls at a local school. Today's discussion, their goals for the future. One wants to be an architect, one a veterinarian. Another says she will get her master's degree and then become a businesswoman. And it's not only girls who are changing. The clinic also helps to nurture the father's part in parenting. Going to be a good father.
Excelente padre.
Excelente padre. The helping hand of Por Cristo reaches from Guayaquil on the coast, 10,000 feet up into the Andes, to a small village on a mountainside, and to a major children's hospital in the heart of Quito. Dr. Lucia Gordillo is a gifted pediatric cardiologist at Baca Ortiz Hospital for Children. But without the help of Por Cristo, including costly equipment donated thousands of miles away in the U.S., Dr. Gordillo would be severely handicapped in diagnosing heart problems.
It was 1996 when we first met Por Cristo. We didn't even have an ultrasound machine. Then we were blind. But thanks to Por Cristo, we began to see.
The hospital is teeming with parents waiting with infants and children to be seen. Many have heart problems. They travel here from all over Ecuador, trips that take as long as 15 hours on a bus. Dr. Gordillo knows that as the Bible says, the poor you will always have with you. She knows that they will keep coming for help and that Por Cristo will not abandon them.
We are so grateful to all the donors. Thanks to them, Por Cristo doesn't just bring us new machines, they also come and spend time with us and teach us how to use them.
Outside of Quito, Por Cristo partners with the St. Hildegard Clinic to provide medical help to this poor village. 10 years ago, with the help of 2 energetic nuns, a team of doctors from St. Elizabeth's Hospital in Boston helped Por Cristo make great inroads against tuberculosis. Then, Por Cristo turned its attention to broader community health issues, like parasites, which are widespread in this area.
Thanks to Por Cristo, we have been able to do many things, helping people with things like prevention and health education talks. We are so grateful for everything Por Cristo has given us.
There is so great a need, it might be easy to fall into despair. But not here, not for the people of Por Cristo. They know they are changing the course of lives, rescuing people from generations of poverty. These children will live in a brighter and a healthier world. Their future will be different because of the commitment of Por Cristo.
$1 to Por Cristo goes a long ways in Ecuador. And to take care of a child and to hopefully offer them a little better life because of your involvement means everything. It means everything.